Good morning, ladies and gentlemen, my colleagues. My presentations from Sitenko Institute of Spinal Joint Pathology, National Academy of Medical Science of Ukraine, is named Paravertebral muscles. What does this mean for lumbar spinal fusion? Paravertebral muscles have several functions. Active movement of the trunk, postural support for the body, protection of spinal cord and nerve structures, blood supply and provision of venous drainage from the structures of the spine. On these pictures you can see the blood vessels of the spine. This is the atlas of famous anatomic people Sinelnikov prepared in Kharkov Medical University. The venous network consists of two internal and two external venous plexuses, widely anastomosis. Muscles play a very important role in the blood supply of the different structure of the spine. On this picture, demonstration role of the muscles in the evaluation of metabolic products, inflammation factors. If we have bad walking, such products accumulate in the disease zone. Materials and methods. We divided the next groups A, B, C, D with disc herniation, instability, stenosis, or degenerative spondylolisthesis. In addition, we have an analysis of 93 CT scan of the lower lumbar spine of the patients under the age of 21 or 12 healthy volunteers. It was clinical examination, CT scan, histological examination, experimental modeling and statistical data analysis, and materials of experimental research. 20 laboratory rats, age 5 months, weighs 400 or 500 grams. The first series is animals that swarm before and after surgery. The second series, animals that swarm only before surgery. Third series, animals that swarm after surgery. And the series, animals that did not swim at all. You can see the rat swimming and instrumental fusion. It is the best minimal invasive fusion. Histological examination. The result of surgery was evaluated as satisfactory. In histological study detected new formed bone tissue at the base levels of spinous process of vertebral facet joints and interlaminar space. On this picture you can see the fourth group where the degree of muscles and vessel change directly correlated with the quality of spine fusion. And the values of angle extension and time retention of the body before surgical treatment. And the next values of angle extension of time of retention body after surgical treatment. To do the 663 axial CT scan images were studied. Some areas of muscle, connective and adipose tissue were selected of axial slices on CT scans of 7-10 mm diameter. As a result, we have got values of parameters which characterize selected region, house field units, minimum and maximum values of X-ray density, its average value, standard deviation, and two peak values based on this scatter point were created. And on this picture you can see CT scan, the typical CT scan, and after our program. There are program picture, patients with instability, disc herniation, stenosis, spondylolisthesis, and control group. You can see the red muscles, yellow adipose, and connective tissue, blue. And histological investigation of the muscles, instability, disc-herniation, spondylolisthesis, and stenosis. It's a typical histological picture. The result of surgical treatment of all the patients deteriorate. You can see the age and grade of severity after surgical treatment. Is the progressive change during the years, 5 years, 10 years, 20 years, and the next 20 years, 40 years, 60 years, you can see more and more blue and yellow colors. With age, the content of muscle tissue decreases and the content of adipose and connective tissue increases. This is a linear dependence. On this picture, the same with age, content muscle tissue decreases and content adipose and connective tissue increase. This is a linear dependence. The progress of degenerative diseases and increase of age accompanied the decrease of muscle tissue and increase of adipose and connective tissue. You can see the progress and yellow and blue colors. Results of surgical treatment also depend on the duration of the disease. The worst results have patients with longer course of disease. On this picture you can see the change in the control group, red, yellow of muscles, spondylolisthesis, and stenosis. On this picture diagram of the results of surgical treatment depending on the preoperative severity. And the next results of surgical treatment are worse in patients who had a higher content of adipose tissue and a lower content of muscle tissue before the surgery. On this picture we present an algorithm for predicting the results of surgical treatment of patients with degenerative diseases of the lumbar spine depending on the preoperative stage of the paravertebral muscles. On this picture you can see the different pictures of patients 48 years old with good results after operation. You can see red, yellow, and blue, yellow. It's the muscles tissue and the connective tissue, the histological investigation. And the next, the patient, 32 years old, herniation of intervertebral disc, 4-5 with satisfactory results, but you can see it's not very good muscles. And clinical example number 3. The patient, 65 years old, with spinal canal stenosis with unsatisfactory result. You can see on the picture of CT scan demonstrated possibility of our program. You can see the yellow and blue colors, the adipose and connective tissue. And the conclusion is established that degenerative changes in muscles correlate directly with degenerative changes and of other structures of the spine and progress according to the diagnosis in the following order: instability, disc herniation, spondylolisthesis, or degenerative stenosis. And clinical signs of the less satisfactory recovery after surgical treatment: patient age more than 48 years, longer duration of the disease more than 6 years, and diagnosis of spinal stenosis or spondylolisthesis. And as a result of the analysis of the algorithm predicting the results of surgical treatment, it was discovered that the main indicator which determines and unsatisfactory results of surgical treatment is the total fat content of more than 14.5%. Moreover, a significant amount of the fat tissue was found both in the total content and adipose tissue, and for the content of adipose tissue in each of the muscles separately. And thank you very much for your attention. Thank you very much for your invitation to take part in the conference, and I wish you a good walking, and I hope in the next year will be a good situation, and we will have meeting face to face. Thank you very much.